Columbus Community Hospital is a critical access hospital, so very different size than Mercy. We have about 260 employees. We're licensed for 25 beds. So we're running that facility on the critical access basis. So very different challenges when it comes to a workforce. We are sometimes left with not enough patients to keep the staff busy, but we have to have a certain number of staff there, and how to keep them engaged when that happens. And then when our census does go up to 25, which it does, then we're scrambling for staff. And then we're asking them to do more and work harder and run faster down the halls. So it does get challenging. We have about, our average age of employee is 47, so a little bit older average age. And about 40% of our workforce is over 50. So we are looking at that baby boom generation retiring and saying, what are we going to do? There's a lot of reasons, and I'll get into some of those, for the mature workers to exit healthcare, including the pace of change, healthcare reform, technology, and so how do we make everybody comfortable with that? So one of the things we've done is similar. I mean, we have the flexible scheduling. We have 8-hour shifts, 12-hour shifts, some 4-hour shifts, very similar. We do not have seasonal workers, and we do not have the weekender program anymore. I mean, that's pretty popular in healthcare, but with our small size, that was just causing problems. I mean, we had people choosing to work weekends and get on that weekend program, which a lot of facilities pay the weekend people more because they're working every weekend, but then we didn't have enough staff to work during the week. So we had to get rid of that. So all of our mature workers do share in the weekend rotation and the holiday rotation, so that's a little bit different. I think they rather enjoy it though, now that they're used to it, because typically, especially in our facility, because we're smaller, we see a bigger discharge of patients on Thursdays and Fridays than we do on Mondays and Tuesdays. So the weekends kind of are a slower pace, more manageable pace for the mature workers. As far as re-careering and benefits, I think the one thing I want to talk about is our tuition reimbursement program. And we focus people in their 30s and 40s to go back to school to further their education, because as the nurse gets older, that work is very physically demanding, mentally demanding, very stressful. And many of our nurses have told us they don't want to be having people's lives in their hands, you know, when they're approaching 70 years old. It's just too much stress on them, both physically and mentally. So a lot of our other positions that we try to steer them towards are quality positions, case management positions, where they're still having contact with patients and patient care type of things, but they don't necessarily have that life in their hand per se. So our tuition reimbursement program, a few years ago, we increased the dollar amount for our employees to go back to school to $20,000 maximum. I think that's probably best in class in our industry. As I look at benefit surveys, it's, you know, sometimes there's a max around 10 or 15, but we will give people $5,000 a year up to $20,000. So out of 260 employees, we are now up to 19 that have taken advantage of that. So every year when the budget comes around, I say I need more. But that's good, because the other challenge we have as a smaller facility is once you get into a position like that, let's just talk about our quality director. Everybody knows quality in healthcare is becoming more and more in the forefront. It's in the newspaper, it's online, you can, you know, look up and see, you know, on Angie's List how your doctor is rated. So quality is extremely important, but in a small facility like ours, a position like that is the only position. So the person in that position has to be very well prepared with years of experience on the floor, their education, their problem solving and critical thinking. Those are two key elements in a position like that, and their ability to multitask. And we have just found, and I can say this because I have a millennial son, the younger kids don't multitask very well. If they're texting, that's the only thing they're doing. They're not hearing what you're saying at all. So those are some of the things that we thought that higher education could bring to the staff and allow people different opportunities to get out of that fast-paced, high-stress type of position. Other things that we have instituted are, we have we refer to it as a convenience benefit package. And this actually benefits, I think, the entire workforce, but it was developed to benefit the young employees, those in their 20s and 30s, as well as the older workforce. So because we know work-life balance is extremely important as well, sometimes life gets in the way and you're more distracted about getting your oil changed, or where you have to stop after work and oh my gosh, I'm too tired to stop. So when our employees come to work, they can get their oil changed while they're there. They can ship their FedEx packages. We will mail their mail. They can buy their over-the-counter drugs from us. They can purchase diapers because the grandkids are coming this weekend. All of that type of thing. And we surveyed our employees, and the younger generations were telling us, they have to stop and pick the kids up at daycare, and then they have to buy milk, and then they have to, do all this, and they are not getting home for another hour, and it's stressful. So they wanted to cut their FTE back. And the older workers were telling us they're just too tired to do all that when they get done with work, even though they still need milk and they still need to get their dry cleaning done. So we thought, well, we'll bring that to the workplace. So that is very highly regarded in the eyes of our employees, and it works very well. Some of those things are payroll deducted for them, so they don't even have to pay for it that day. So, in fact, I just had my truck in for an oil change this week. Some weeks I bring 3 different vehicles every day. So those are, some of those convenience benefits. I think I could probably talk about those, for another 10 minutes. But it's those types of things, those things that bring work-life balance to the workplace. And we don't also, another thing, when we're orienting new employees, everyone is shocked when I say, if you want to get on Facebook and just take care of something, get on Facebook and take care of it and then get back to work. A lot of workplaces have kind of banned those kind of things, but we know that everybody has things happening in their personal life that they need to take care of occasionally.
Can you share about the benefits, the health benefits?
Sure. Our health insurance is available to anyone working 20 to 40 hours a week on a regular basis. So every employee pays the same. There's not a higher price for those part-time employees. Now with healthcare reform, you're all familiar that 30 hours is considered full-time. So eventually you'll have to provide health insurance to anyone working 30 hours or more. But we have already taken a stand that we are going to continue to offer to those 20-hour people. It's just important to offer that flexibility, especially for the mature worker who maybe doesn't want to work, an extreme amount of hours, who can't work an extreme amount of hours. So that's the way our health insurance is set up. That's the way dental, life, all of our benefit programs are set up for 20 hours or more.
Can you talk about the impact that's had? You're in a smaller community, not too far from Madison, so they're in Columbus, so people can certainly drive to Madison. Can you talk about the costs, because obviously there's significant costs to pay for benefits at just 20 hours a week. We hear that all the time. Why would we want to pay the same amount for a 20-hour employee versus a 40-hour employee? We're losing that 20 hours we're getting from them in return. But what's the cost, and how does the difference versus keeping and retaining or drawing quality employees?
Yeah, we did an analysis of that a few years into offering that insurance at 20 hours at the same dollar amount at the 40 hours. And we found that our recruitment costs significantly went down, as well as our FMLA significantly went down, because that sandwich generation that is caring for kids and patients, if you're working 20 hours, you may not need FMLA. You can, volunteer your time and squeeze in your days with your parents on your days off. And the last thing I think that we found is that the engagement went up. We do engagement surveys every year, and that kind of significantly rose during that time, and that benefit package was a big part of that.
Have you you done any research as far as re-careering when you were talking more about moving over? Has there been any notice of loss of injuries or any workers' comp issues or anything because you've moved them to non-physical, not as demanding type jobs?
Well, I think that would be hard for us because our numbers just aren't that high.
Okay.
So our workers' comp is very low to start with. And that's a problem too. When you're looking at benchmarking and trending, you kind of have to common size all of those benchmarks. But I would think that, as people are re-careering into some of those more stationary jobs, they're doing it because their back hurts and their legs hurt and their varicose veins are getting bad and, things like that. So, that physical limitation is probably the number one reason that people come to see me to talk about, what else is there that I can do. So, and we will cross-train anyone. In fact, all of our nurses are required to cross-train to at least one other area. They're not hired for a specific department, and that is very beneficial as well. So if we have someone with some work restrictions or, somebody's just not feeling well today, they'll flip for the day. They'll say, I'll do your job, you do mine. It's not as formal as a job sharing, although we do have some formal job shares as well, but it's because we're small, I think we can be more nimble in that day-to-day staffing type of thing. So that's an advantage of being small.
Are you talking about any other upcoming changes or programs?
Well, I think the main thing we've been concentrating on is the fact that we are going to continue to offer all of those benefits to the 20-hour people as well. And you, as business people, are going through the same type of decision making. If you get online, you can see that certain companies have already said they're not going to employ any part-time people unless they're under 30. Under 30. Under 30 hours. Under 30 hours, so that they don't have to worry about that. But we have just taken the stand, we're healthcare and we need to get out there and, set an example for other industries that it's okay. I mean, you will get the return for your money on that investment.